Okay, so you mentioned that this is the only variable. Mm-hmm. How long have you been here? For a month maybe or so? Those x-rays were taken on 5/29. So, oh gosh, we got to be doing x-rays real soon on you. Yeah. So got to be this week. So you just mentioned some of the things. You said your congestion was better?
Yeah, it's
Go ahead.
better.
Go ahead, keep it.
Congestion is better. I've been losing weight, which is not normal for me.
Okay, so I want to talk about that. You said you're losing weight. Mm-hmm. What have you done differently since coming in here? About your diet change?
Drinking more water.
Okay.
I've been taking walks.
Okay.
Everything is pretty consistent.
Okay, but no real big,
no,
not like you're changing, okay, all right, not changing meal plans or anything like that. Okay.
I don't eat junk food.
Okay.
I mean,
okay.
Pretty balanced diet.
Okay. Okay, good. So while you're at it, do you want to say anything else besides the congestion and the weight? Anything else? I mean, besides the major complaint you came in with.
My flare-ups for my RA, they've lessened way, like, nothing compared when I was on medication.
Okay. So fortunately for you, when you came into the office, you were done with medication by then, right? Mm-hmm. Okay. So one of the things that we see when people get cleared out, subluxation and less nerve interference, the body starts working better. Now, if you would have came in here taking RA medication, which is an immune suppressor, you would not be having the same results because you're poisoning your body with some type of chemicals in there. But that you came in here not taking anything and saying, you know what, I'll deal with the flare-ups instead of taking the medication, your results are getting better there. So we've done so many videos on rheumatoid and autoimmunity. I want to focus on the other one, the fatigue. Or not the fatigue, you said the weight.
The weight,
okay?
yeah.
So you're not doing anything differently? Okay. Pretty much most of the things are the same. Okay. So let's talk about, let's see if we can figure this one out, okay? One of the areas in the lower cervical area there, now this is just a hypothesis here, okay, that innervates the thyroid, okay? Thyroid, if you make the right amount of thyroid hormones, you have a normal metabolism. Now, you know, many people, especially women, go on thyroid medications. Have you been recommended for that at all?
No.
Thank God. Okay, good. I know you don't take it. But if you get a better nerve signal into the thyroid, your body can make the proper amount of thyroid hormone to raise your metabolism to a normal level. So that you said you've been losing weight by doing virtually nothing different, and you said your pants were loose, you said. Yeah. That's a big change, so congratulations on that. But that's the same thing for everything else. The rheumatoid and stuff, of course, the middle dorsal is mostly the thymus area, maybe the lower cervical too. But that's where your T cells are made, so congratulations, fantastic. All right, great. So that lower cervical in there. Or middle cervical, we'll see. See, this is the area that goes into the thymus there. And that's where your T cells are made. And this was really the thing that brought you into the office, right here. But I'm still seeing some pressure there. Not as much as it once was, but still there. Okay, let me take that. I want to go more tender here, or I want to go up to the top here? Lower or upper? They're about the same.
They're about the same.
Yeah, thank you. Fine. Okay, so when we look at the x-rays, you have a partially fused, it looks to be partially fused, your L5. I can't tell, but it certainly looks, it's certainly on the right side. But that is the area that's actually getting choked off here at the L5. Usually when we see those transitional segments is what they call them, because it doesn't know if it's a lumbar or a sacral segment. Usually that seems to be the area that we see it, and that's definitely where your L5 pressure is. In the middle dorsal there, we're seeing it up at T4 area there, and it's pretty rotated. That almost makes it look compensatory. And then that lower cervical there, that's C6 is where we're going to sit. So let's come on over here and get you adjusted. Okay, good. Okay, scoot up. Okay. Hear my daughter talking about how she's going to go play with Maverick? Good, then I don't have to. Okay, go ahead, breathe out. Okay, L5. Okay, nice and gentle. Come on over here. So your middle dorsal, this area innervates that thymus. And I had asthma as a kid up until I was in my late 20s, and I went to the chiropractor, got adjusted, never had an asthma attack. After age 28, again, it was absolutely incredible.
I haven't used my inhaler since I've been coming here.
Great news, look at that. See, the only, breathe out. Okay. The only side effect of chiropractic is good health. I would say side effects you can say, but it's always good health. Like, oh yeah, and by the way, this is better too. And that's why when we do those symptom forms, I ask you those questions, because you wouldn't even relate the two.
No.
And you wouldn't have. I mean, you would have been, oh, my back's better, but you wouldn't have thought about anything else. So have a seat. Oh, I'll take a little more cycle. Okay, nice and gentle. So let's recheck here. Okay, so you're clear.
What a difference.
It's nothing like a chiropractic adjustment. I'm so glad you're getting the full benefits, not just the symptom that you came in for, which everybody's the pain, but the body functioning better.
Yeah, I haven't had like that back pain like I initially started.
I remember that.
Yeah, achiness here and there.
Yeah.
But it's better. For
Good.
sure, 100%.
And sleep?
Better.
Yeah.
Like
You good?
the most sleep I've had since I had my baby.
Fantastic. All right. Well, your body's coming down from that fight or flight for all those years, so congratulations.
Thank you
Your
so
extras are
much.
coming up. I can't wait to see them.
Okay.
Good job. Thank you.